You're most welcome to today's talk. It is Wednesday, the 3rd of March. I'm going to broaden out our perspective today a little bit and look at wider factors that are influencing the course of the pandemic. But before we do that, this is the current situation. So Canada, we see the cases are flattish, going up probably very slightly, but flattish. United Kingdom going down, of course. United States has been going down nicely, but less steeply now. Big difference is that these numbers in the UK, we already have the B117 variant, as we might say, baked into this data, whereas the United States, we don't really. Other countries that are a bit of a problem, I've just left the UK in as a comparator here. We see cases going up in Sweden, in the Mediterranean island of Malta, and in the Czech Republic. Czech Republic's actually got the highest number of recorded new cases at the moment, and it's had a very spiky, that's a spike in the Czech Republic there. That's another one there, look like another one coming. Let's hope they can get it down, as I clicked the wrong thing. Let's hope they can get it down as quickly and it doesn't climb any higher. But we do know that, well, it's hard to say actually, but we believe that from the news reports that I'm getting, Chechnya and Malta, the public compliance with the community health measures and the mitigation measures is not as good as it could be, although comprehensive news not readily available from those countries, not in English anyway. That's why I sometimes use translators. Anyway, in the UK, the trend, as we've said, is good. So cases, that was the number of new cases in the last 24 hours, just over 6,000, so coming down. That's the number of new cases in the past 7 days, also going down. And the number of cases in the past 7 days represents a 29.4% reduction, so good direction. Hospital admissions, well, this is still a lot of new people being admitted to hospital in 24 hours, and it's still a lot in the week. So not saying the hospitals are clear or back to normal, not by any means at all, but still a reduction in 22.1% on the week. So the trend is good. Still a significant problem in hospitals. Deaths, well, again, the numbers are down, but this is still 343 people have died in 24 hours. Nearly 2,000 died in the past week, although that number is down 36%. So again, the trend is good. But the numbers here are still significant. This is still quite a lot of people dying. Vaccine first dose, well over 20 million now in the UK. Second dose, heading up towards the million mark. Now, vaccines per 100 people in countries with the highest total vaccination. So these are the ones that are leading the field at the moment. Israel, of course. Wow, 92. Now, this is the total number of doses given. So this is not saying 92.5 are vaccinated. That's the total number of doses given in relation to 100 people in the population, but still exceptional. United Arab Emirates, also good, smaller population, of course. Then it's the UK, just over 31. Coming up to a third of the UK population had at least... Actually, that's not true. It's not quite true because this is the total number of vaccines given. But there again, the number of second doses given in the UK is relatively small. So it's looking at about 30% of the UK population vaccinated now. The United States is accelerating. And more on this later, but we had anticipated this, that the United States would accelerate its rollout, and it is not disappointing. Still behind the UK, UAE and Israel, but accelerating. And we'll look at some reasons for that. Turkey, Germany, France, Brazil, China, India. Surprised China is still so low. Of course, China and India, massive populations. So the total number of vaccines given out are high, but not making a huge dent in the overall percentages of the population vaccinated. Now, President Biden has been saying some useful things, so let's have a quick look at what President Biden's been saying. Now, this is really illustrates the point I was making. This is quite spectacular. It really is impressive, actually. Enough vaccines for every adult by the end of May, 2 months earlier than expected. So 100 million doses of vaccine in the first 100 days of the presidency, well on track, about 1.74 million doses being given per day. So well on track. Now, to maintain political neutrality, I think we should say that all these vaccine programs were instigated and the research was ordered under Operation Warp Speed, which of course was the Trump administration before this. But it's carrying on nicely, and basically I'm not too interested in the politics. The key thing is that 1.74 million people are getting vaccinated per day. So it's accelerating. And the fact that this has happened within 15 months is stunning. Now, Merck, big pharmaceutical company, helping Johnson & Johnson now in production. So it looks like what happens is Johnson & Johnson production for the Janssen vaccine, of course, the single dose kept in a fridge, high efficacy against serious disease and death vaccine is being produced in Merck facilities. So that's going to greatly increase the production. Direct quote from Mr. Biden: "We're now on track to have enough vaccine supply for every adult in America by the end of May." Impressive. The type and collaboration between companies we saw in World War II. Now, young people might not realise this, but basically the reason that, well, it's complicated, but I think it's safe to say that the vast majority of the hardware used in the Second World War by the Allies' power against the Axis power was produced in the United States. So the vast majority of UK equipment, British equipment, was produced in the States, or the American equipment was. And what a lot of people don't know is a very, very sizable proportion of the Russian equipment was produced in the United States and exported to the Soviet Union via the Baltic Seaways, which is a separate story. But it just, the point I'm trying to make is that once America gets going with production, it's got massive industrial capacity, and we're seeing that even in this bioscience thing, and it's good to see that Merck are now producing the vaccine. So I knew America would really get going, and this could be doubled before too long. I think the limitation in America now is well, maybe not now, but soon will not be so much the supply, it'll be the amount of people to actually vaccinate it. But all nurses should be able to give intramuscular injections safely, so that shouldn't be a logistical problem that's difficult to overcome. And all doctors can give intramuscular injections, although they don't very often, but all qualified nurses should be able to give intramuscular injections. We certainly taught every single student how to do it meticulously. So President Biden again, stay vigilant, the fight is far from over. He did mention the variants of concern that are the big problem in the States. We cannot let our guard down or assure that victory is inevitable. So in other words, Mr. Biden here is clearly saying, and of course we agree with him, that things could still go wrong. And it just reinforces that. We can't assume that. Now, a bit more on the response to the president's talking later. But first, Dr. Fauci has been doing an interview on vaccinations for children. Now, it surely is inevitable that children will need to be vaccinated against SARS coronavirus 2 at some point. I think that is inevitable, that the majority of the world's children will need vaccinated, because without children being vaccinated, they could pass the infection between them, and herd immunity may be years away if we don't vaccinate children. It will probably come eventually because of natural immunity, but I think it's inevitable that children will be vaccinated. And this is nothing new. Children are vaccinated against all sorts of things. So inevitable, I think, and this seems to be Dr. Fauci's thinking. Children under the age of 12, his word, very likely the end of 21 or the beginning of 22, and it's based on his projections of how the data comes in. Now, quite a few of the pharmaceutical vaccine producers excuse me, are now doing trials on children. So these are in hand at the moment. But it's going to take time to collect that data, is what Dr. Fauci is saying. I would think that there would be, at the earliest, at the end of this year, very likely the first quarter of 2022. So it looks like this time next year we will be vaccinating children in the States, and I am sure that is very likely to be happening in the UK and all around the world. Older students, high school students, will likely be able to get vaccinated this autumn, so that's good. earlier on. And he did mention the term herd immunity or community immunity, which we'll be getting closer to. Dr. Fauci encouraged Americans to continue to wear face masks, avoid crowds and follow social distancing guidelines, as indeed the president had done in his speech just before. So Mr. Biden and Dr. Fauci seem to agree. You've got to get that baseline down lower than it is now. So what he's saying is that there's still a lot of new infections and there's still a lot of infection around in the States. We have to get that baseline down before we can start relaxing. And Dr. Fauci also particularly mentioned some homegrown variants in California and New York, and we know that the B117 is accelerating in the States as well. Now, in response to this, sorry, that was sarcasm, not in response to this, independently to this, Governor Greg Abbott of Texas, end of statewide mask mandate. Perhaps not a good idea. He's going to end the statewide mask mandate. Businesses can open 100% capacity on the 10th of March. State mandates are no longer needed. Direct quote. Oh, look, I've put crosses there. It must mean I disagree with all of those. Now, to be fair, we can understand the reopening and the urge for reopening and the massive economic implications of that. I understand that. But to wear a mask doesn't cost anything. Why would you not want to carry on wearing a mask as you work? So I can understand the business thing. I'm not saying I agree, because we could have a resurgence and it could cost even more the next time if you're just looking at it from an economic point of view, regardless of the human cost. But why not wear masks? It doesn't cost anything. This is the part of the psyche I just don't get. Is it going back to this idea of masks being a political statement? Masks are critical, not political. I don't get that bit at all. I really don't get it. Mississippi removing order on mask wearing today, as far as I know. Bad idea. Now, I'm sure most people in Mississippi and Texas are completely responsible citizens. And if you are watching this video and you live in Texas or Mississippi, then obviously, by the virtue of the fact you're watching this, means that you will carry on wearing a mask, I am sure, because you're showing an interest and responsibility. But it means that some people won't. Some people's thinking is so simple. They actually think, oh, well, the politicians say I don't need to, so it must be all right. That is the level that some people's thinking works on. But these people can transmit disease just as much as someone who's analysing the spread of the virus for their doctoral thesis. They're still humans. They will still spread it just the same. So really bad political messages in my view, and I'm sure in your view if you're watching this video. Michigan easing capacity limits on restaurants, public and residential settings, so more people allowed in. South Carolina, Massachusetts, Chicago also reducing restrictions. Now, this next one actually shocked me, because we've looked at the terrible situation that there has been in the hospitals in San Francisco, California. So easing of rules on museums, cinema, gyms and indoor dining in San Francisco at this stage, that surprised me. That really surprised me. So gets across from me, but I'm not in charge. They are. Now, European Union. Again, this is looking at the... I kind of ummed about this. I don't think it's political. I think what we're looking at is wider factors that actually influence people's well-being. So I'm going to do it. If I'm being political, tell me. But it's not my intention to be political. It's just looking at wider factors that influence people. Now, Austrian Chancellor, Mr. Kurz, has said this: Austria would work with Israel and Denmark on second-generation vaccines. No longer rely on the EU in the future. That's a direct quote. European Medicines Agency, too slow as a direct quote. We must therefore prepare for further mutations and should no longer be dependent on the European Union for the production of second-generation vaccines. So here we have the Chancellor of Austria saying he does not trust the European Union to produce second-generation vaccines. Now, we are producing second-generation vaccines, or working on second-generation vaccines, of course, in the UK now and the United States. these are vaccines that are going to be effective against possible new mutations of the virus and current known mutations of the virus, of course. And it's likely that we're all going to need a third dose of the vaccine, perhaps late 2021 or early 2022 over the next winter. So that's quite possible. And for these, of course, we'll need much more specific second generation vaccines. And he doesn't trust the European agency to facilitate that. Denmark Prime Minister, now she is saying bid for supplies of Israel's leftover vaccines. So the Denmark government has put in a bid for Israel's over-ordered, of course. So it wants some of their leftover vaccines. Fair enough. So Mr. Kurtz and I'm not going to try to pronounce your name, Mama, I don't know it. Prime Minister of Denmark, anyway, you are both going to Israel. So here we have the Chancellor of Austria and the Prime Minister of Denmark going on, as far as I know, a joint fact-seeking mission to Israel, presumably to work out what Israel has done right in facilitating the vaccine rollout as the world's leader. So that's Austria and Denmark, but it gets worse. Poland, European Union country, of course, is talking to China about supplies. Slovakia, 2 million doses of the Sputnik delivered already, we believe. And this is a vaccine that's not been approved by the European Medicines Agency. Czech Republic, due to buy Sputnik vaccine as well. Hungary has already approved and bought 2 million doses of Sputnik vaccine, so it's already approved by their regulatory authorities. They've bought 2 million doses. Viktor Orban photographed him. Viktor Orban, Prime Minister of Hungary, of course. Photo of himself being vaccinated by the Chinese Sinopharm vaccine, and they've got another 5 million doses ready to go. We've sought to do something together that we could have managed more successfully on an individual basis. Take a look at the examples of Britain and Serbia. So when he says we, of course, he means the European Union have tried to do it together, but he said it would have worked better had they have done that as individual countries. So these are things that are influencing the well-being of people, which is why I'm mentioning this. France, we believe that regional leaders are trying to negotiate directly with pharmaceutical suppliers. So in France, it's not even the national government, it's individual regions. Now, the situation in France is complicated. There's a lot of cases in the east side of France, bordering with Germany. And it looks like a lot of vaccine supplies have been diverted from the west of France to the east of France to try and sort of quell the outbreak there, rather than vaccinating those that are most at risk of death first of all. So some regions in France seem to be trying to do their own negotiations. Germany have ordered 30 million extra doses from Pfizer and 20 million doses from CureVac. Now this CureVac, don't pretend to know everything about it. It's an mRNA vaccine, I'm pretty sure. It's a collaboration between Germany and the US, or German and US interests. So there we go. Germany's ordered 50 million doses of vaccine outside of the European legislation where it's supposed to, or the European organisation that's supposed to. Ursula von der Leyen assures that we have agreed that there will be no parallel negotiations or parallel contracts. So that's what she said. It appears from this that Austria, Denmark, Poland, Slovakia, Czech Republic, Hungary, France, and Germany don't agree with Dr. von der Leyen. So, make of that what you will. The thing that I care about is that the vaccination is remarkably low in the European Union, and that means that people are still suffering and dying unnecessarily. And of course, the ongoing social disruption of the other measures that are required. And it means that the United States and the UK will emerge from this pandemic earlier than European countries will. That is now surely inevitable. Other European news, Malta, as we've mentioned, small population but cases are going up. We believe that's due to failure of compliance. Now, what seems to be happening in Malta is people are actually behaving themselves at work and then less disciplined after work. But cases are going up. Italy, Oxford AstraZeneca vaccine not given to over 65s or people with any disease or health conditions is the situation now, today, despite the overwhelming evidence that we gave yesterday on this channel from the English data, and despite the overwhelming evidence that we gave must be a week ago now, from the Scottish data on this channel. Does not seem to be an evidence-based situation in Italy. Currently, it seems like I'll have to wait at least till next year for my vaccination. Now, that's someone who's written to me, private citizen from Italy, whose name I don't have permission to disclose, but I do know who they are, and I sense their frustration. Spain, also not following the evidence. Oxford AstraZeneca vaccine only been used in under 55s. And Spanish government now seems to be advising 1 gram of paracetamol before the vaccine is given and 6 hourly after the vaccine is given if minor side effects appear. Now, if you're in the States, paracetamol is acetaminophen, which is Tylenol. Basically, it's an antipyretic. That means it brings down body temperature. Now, my understanding is, and we've talked about this before, that the immune system works best at pyrexial temperatures. So to artificially, in adults at least, to lower the temperature during infection or after vaccination would potentially mean that the immune response generated is not as good. But there again, doctors in the UK are advising paracetamol for vaccine side effects as well. I think they're wrong, and I think we've looked at evidence that does suggest they're wrong. And personally, I would rather put up with minor side effects for a period of time, get a better vaccine response. Is it true there's a better vaccine response? I think it will be, but we don't know because no one seems to be collecting the data. So this data is just sitting there waiting to be collected. We could easily get people to report whether they took antipyretics like acetaminophen or paracetamol after their vaccine or not. Compare the immune response. If we were looking at several million people who were vaccinated, that would be big enough to discern, even if that was a relatively small effect. But no one seems to be doing that, unfortunately. Such great research opportunities going to waste. Now, talking about official bodies that we've just looked at, European Union Medicines Agency, we could say, has failed its people. Let's just remind ourselves of why we're here in the first place. World Health Organization, this is from the 30th of January 2020. Dr. Tedros says this. Firstly, the direct quote, firstly, there is no reason for measures that unnecessarily interfere with international travel and trade. So this is the 30th of January 2020, he said this. No reason. No, there's no reason. It's a pandemic, infectious disease, but there's no reason not to travel around. You can still fly around. International travel and trade. Who doesn't recommend limiting trade and movement? Now, the World Health Organization does not have power to mandate grounding of airline fleets. But had that happened for just a few weeks, we probably would have had no pandemic now. So they're actually saying World Health Organization doesn't recommend limiting travel or trade. Just go on as normal. I mean the magnitude of this failure, the magnitude by which the world has been let down here. You know, if the World Health Organization had said, well, the World Health Organization has no power, but because this disease is infectious, because it spread quickly over China, because there are, I believe at this stage, a few cases around the world, what we need to do now is just close down these international flights for a few weeks, close flights down from China for a few weeks, get on top of this thing. And the Chinese, if we'd kept the virus in China, if we hadn't kept on flying out in and out of China, then China did manage to virtually essentially eliminate the virus. But it had already escaped on airlines. But the World Health Organization said just carry on travelling and trading. So look at the lives that have been lost as a result of I believe as a result of this. Look at the economic cost. And yet, of course, no accountability that I can see whatsoever. So has anyone at the European Medicines Agency been replaced? Have any European politicians been replaced? Has the senior leadership at the World Health Organization said that been replaced? No. Accountability is just for plebs like you and me. It's not for senior important people. Okay, I think I made that point now. So if I can calm down again. What I'm saying is, and what we've shown on this, that there are much wider factors that influence the spread of this pandemic to this point, and will influence the spread of this pandemic on an ongoing basis. Will the world learn for the next potentially much more deadly pandemic? I doubt it. Has the world got the potential to learn for the next more deadly pandemic? Clearly, massively, they have. But given the performance so far, they may not. And this whole lack of accountability is just it's really quite hard to explain, really. You can say things that are wrong, and anyway, you get my message, and you sense my frustration. Okay, that is us for today. I think we'll stick with something very simple and scientific tomorrow, but I think these things are important. I don't want to shy away from them altogether. Thank you for let me know what you think. If it's been too political, apologies. But this is what affects people's lives and indeed the difference between life and death. So anyway, thank you, of course, for watching.